and welcome to the Grow and Go podcast. My name's Claire, and today I am joined by Dr Merryn Netting. Merryn is a paediatric dietitian with over 30 years' experience working with families, babies and young children at the Women's and Children's Hospital in Adelaide. She specialises in allergies and now works for the National Allergy Council. The National Allergy Council aims to reduce the impact of allergies on the Australian community and health system. It is funded by the Federal Government Department of Health and Aged Care and is a partnership between the Australasian Society of Clinical Immunology and Allergy and the consumer organisation Allergy and Anaphylaxis Australia. And in this second episode, we're going to be discussing the role of early education settings in managing food allergies in the children in their care. This podcast was recorded on the lands of the Yagara and Turrbal people, and we pay our respects to their elders past and present. So hi Merryn, thank you so much for joining me today.
Thanks Claire, thanks for having me.
So what would you describe the role of the early childhood education and care sector in caring for kiddies that have a diagnosed food allergy? What do they need to be doing?
So, there's quite a lot that a childcare service needs to do. And I think part of it, is all around providing a safe environment, isn't it? So there's actually quite a few things that a service should have in place. So the National Allergy Council would be encouraging childcare centre services to have appropriate documentation, to have a policy about reducing the risk of an anaphylaxis, and then working with families of children to develop individual care plans, and that would include their ASCII action plan written by their doctor. And then services need to make sure that their staff are really well trained. And part of that includes the recognition and what to do if an allergic reaction happens, and including refresher training and practice with the adrenaline injectors as part of their first aid. Also, cooks and chefs and educators who have anything to do with preparation and service of food should actually know how to serve a food safely and how to read food labels for food allergens.
Indeed. Yeah, there's a lot going on there. There's a lot of all that sort of pressure and things that the parents have been so vigilant about at home essentially just gets passed over to the education setting to pick up while they're in their care there. And are there any particular things that or ways that educators should be supporting the parents when they are doing this sort of handover of everything to them?
Yes, I think really good communication is the key. And also recognising that, handing your child over to childcare, is a really tender time, isn't it? So, and if you're very anxious about food allergy management, just acknowledging that. So we encourage childcare services to communicate with the whole childcare community about allergies, and that helps raise awareness and encourages the whole community to work together to help reduce the chance of a child having an allergic reaction. And also, if there is a child with an allergy in your service, it's actually good for the other families to understand about that, and also the kids who are also at the service, to learn a bit about how to reduce the risk of having a reaction.
Yeah, I think that's a really valuable one, using the children as a bit of peer support as well, and knowing that going into schools, considering how many kiddies we're talking about who've got these allergies to deal with. So what are some of the really practical things that services can do to help reduce the risk of a reaction happening while they're caring for a child with an allergy?
Yeah, I think that's really important. So having the right processes in place to reduce the risk of a child getting exposed to their allergy-causing food is really important. So and these are going to differ depending on the age of the child. But I think one of the most important thing is to have the right systems in place so that the children always get the right food and the right drinks for their allergies. So this includes for children that are having infant formula, that their formula are labelled, that their special formula is made in a place where it's not going to get contaminated with other formula, and also then that bottle gets to the right person. And then the same with food, making sure that the right food gets to the right child. Some places use coloured plates. Some people use a double checking system. So there's lots of strategies you can put in place to make sure that right system happens to reduce the risk of an accidental exposure. It's really important that kids at the childcare centre all understand about washing their hands before they eat and drink, before and after. And that's just good for everybody to learn how to do, and not sharing food and drinks, not drinking out of anybody else's drink bottle. You have your own drink bottle. You don't just drink out of anything. And then the other thing that is really important is planning ahead for activities and other special occasions. So craft activities, parties, Christmas events. So, when stuff that's a little bit different is happening. So that's often when the wheels can fall off. So having the systems in place and planning ahead is really, really important.
There's definitely lots of things that centres can be doing to help mitigate that risk. I remember when my daughter started childcare that her centre actually removed a couple of different allergen foods from the menu completely, just did a bit of a blanket approach because they had multiple children with allergies and that was their strategy. Is that something that you would recommend centres do to help them manage that risk?
Look, there's a lot more that centres need to do than just avoiding a food allergen. And remember I said before that a child can be allergic to any food. I've certainly seen children allergic to bananas and mango and all sorts of unusual fruits and vegetables. So we prefer that centres are allergy aware, and that is because an allergy aware centre does more than just remove a food allergen. An allergy aware centre has great training, has really good protocols. They manage the food very well right through the whole system. And if a child does have a reaction to a food, that it's recognised and that it's managed really well. So the allergy is something that you need to think about from a whole lot of different areas rather than just avoiding a food allergen.
What if a reaction is happening? Like, what are educators meant to do if they think a child is having a food reaction?
So that fits into their education and training. So everybody, should have some training in basic first aid, and recognising and knowing how to treat an allergic reaction falls in part of that. And in Australia, we have an ASCIA first aid plan for anaphylaxis, which actually sits, with the first aid kit. And centres should have a general use adrenaline injector, which can be used for children who don't have known history of allergic disease, but also they get used sometimes for children that might need more than one dose of adrenaline, or if they have an adrenaline injector that's misfired somehow. So usually children with allergy will come to their childcare service with their action plan and their own adrenaline injector, and that gets stored in a place that's unlocked and easily accessible as well.
So is there some places that educators can go for more resources, maybe templates or things that they can use in a very practical sense to help them build policies or procedures to support their allergy management in their centres?
Yes, the National Allergy Council has a great little website. It's a resource hub. It's called Allergy Aware. So the website is allergyaware.org.au, and we've developed a set of best practice guidelines for prevention of management of anaphylaxis in children's education and care. And so they sit on the website there, and we have a whole lot of resources, including training for childcare staff, food service staff, and then a lot of templates that can be used to develop policy, to communicate with parents, and just be used in really practical ways. There's a wealth of information there on that website.
Yes, there definitely is. And a lot of the resources, or as many as we could find, are also on the Grow and Go toolbox. And we will provide link directly to Allergy Aware in the show notes as well for everyone's reference. And there's also, you link to the ASCIA e-training and things like that as well?
Yes, the ASCIA e-training is the training that we would recommend. So we've helped develop that, and that's because ASCIA is a partner organisation with the National Allergy Council. So we've helped develop the training, and our website links to that as well.
So thank you so much, Merryn, for joining me today. It's been a very interesting conversation. I encourage everyone to go and check out the foodallergyeducation.org.au website for more information on food allergies. For more episodes and to access hundreds of free resources to support your centre and families, visit the Grow and Go Toolbox at growandgotoolbox.com. Check us out on social media on Instagram and Facebook for regular tips on feeding the under fives. We would like to acknowledge the Commonwealth Department of Health and Aged Care for funding the Toolbox and the University of Queensland for supporting this project.